Welcome everyone. Thank you for joining us to learn about breast health. This presentation has been prepared and is presented by the Health Promotion Team at Women's Health Loddon Mallee, BreastScreen Victoria and the Deaf Hub Bendigo in partnership with the City of Greater Bendigo. The information presented here is factually correct and up to date at the time of publication. Please check the BreastScreen Victoria website regularly for any updates or changes. Before we begin, I would like to acknowledge the traditional custodians of the lands on which we meet today. I would also like to pay my respects to Aboriginal elders, past and present. We acknowledge the ongoing advocacy and resilience of the LGBTIQ+ rights movement and stand with them in solidarity. Through our programs, policies and practices, we are committed to addressing the structural and social barriers to health, well-being and inclusion that the LGBTIQ+ communities continue to face. We are guided collectively by the unique and different ways in which the LGBTIQ+ communities experience gender and identity discrimination and continue to listen, reflect and learn as we evolve our approach to ensure greater equity and inclusion across the Loddon Mallee region. Today I'm going to discuss an overview of breast cancer in Australia, including facts and stats. Risk factors, both existing and preventable. The importance of being breast aware and early detection. Also, information about the breast screening program. The prevalence of breast cancer. 1 in 7 women in Victoria will develop breast cancer in their lifetime. While it is common, most people who are diagnosed with breast cancer survive. An average age of breast cancer diagnosis is 62 years old. Australia now has one of the best breast cancer survival rates in the world. 91% after 5 years. 91% of Victorian women diagnosed with breast cancer live. This is due to improvements in technology, awareness, and screening for early detection. Since the breast screen program commenced in 1993, the 5-year survival rate has improved by 30%. Approximately 57 Australians are diagnosed each and every day. Risk factors. There are 3 key non-modifiable risk factors that increase your risk of developing breast cancer. These include 1. Being a woman, as breast cancer is significantly more common in women. 2. Age, as a woman's risk of breast cancer increases with age, with the vast majority of women diagnosed being over the age of 50. 3. Family history, as a woman's risk of breast cancer is higher if she has a family history, but it's important to note that only 5% of all breast cancers are actually caused because of gene mutation or strong family history. Family history. So what does family history mean? Family history is defined as when any of your blood relatives have had breast or ovarian cancer. Most breast cancers are not caused by family history, but a family history may increase your risk. If you don't have a family history, you're still at risk of breast cancer. BreastScreen Victoria now asks questions about family history to identify whether you might need more regular screening. For example, some women will be invited to screen annually, depending on their age and family history. Peter MacCallum Cancer Centre have developed a family risk assessment tool that can develop a risk profile to discuss with your doctor based on a series of questions. Your doctor can do more detailed assessment and may recommend additional testing outside our program. For example, regular ultrasounds or genetic testing. Reduce your risk. There are some things that we can change to reduce our risk of breast cancer. None of these things are surprising. Eating a healthy, well-balanced diet with plenty of plant-based food, maintaining a healthy weight and participating in regular physical activity. Limiting alcohol consumption and avoiding smoking. Being breast aware. Becoming breast aware means becoming familiar with the normal look and feel of your own breasts. There is no right or wrong way to do it. It's really about knowing what is normal for you. How to be breast aware. Use a mirror to get to know the usual look and shape of your breasts. Becoming familiar with the feel of your breasts at different times of the month. You might find this easiest in the shower or bath, lying down or getting dressed. Use the flat of your fingers and the finger pads to feel near the surface and deeper in the breast. Breasts come in all shapes and sizes. The way they look and the way they feel may change throughout your life. It is important to note that a woman will experience breast changes all throughout their lifetime. Changes to the breast can occur with puberty, the menstrual cycle, during pregnancy and breastfeeding, with weight loss and weight gain, and also menopause. Changes to look for. Changes that should be checked by a doctor include discharge from the nipple, especially if it occurs without squeezing. A lump, lumpiness or thickening in the breast, especially if it is only in one breast. Changes in the skin of the breast, such as any puckering or dimpling of the skin, unusual redness or colour change. Changes to the nipple, such as a change in shape, crusting, a sore or an ulcer. Redness or an inversion of the nipple where it is pulled in. Changes in the size or shape of the breast. Unusual pain, which is not related to the normal monthly cycle. If it occurs in one breast only and is persistent. Please be aware that while new breast lump is the most common symptom of breast cancer, it is not the only one. So it is important to see your doctor if you have any concerns. Am I at risk? To summarise the risk factors, 1 in 7 Victorian women develop breast cancer in their lifetime. Many women have someone in their family with breast cancer, yet only 5% of breast cancers are because of a strong family history. 75% of breast cancers occur in women aged 50 and over. Your strongest risk factors for developing breast cancer are being a woman and getting older. Early detection is key. Finding breast cancer early is important. A breast screen can detect most cancers before they are felt or noticed. Early detection of breast cancer offers you a better chance of successful treatment and recovery. Benefits of early detection include increased survival, increased treatment options, and improved quality of life. BreastScreen Victoria is part of BreastScreen Australia, the national screening program for breast cancer. We know that finding breast cancer early is important. A breast screen through BreastScreen Victoria can detect most cancers before they are felt or noticed. Early detection of breast cancer offers a better chance of successful treatment and recovery. Our program. The target population is women, including trans women, trans men, and non-binary people who fit the eligibility criteria. Breast screening is targeted to women aged 50 to 74, but is available for women over 40. A breast screen is recommended every 2 years or annually for some clients identified by BreastScreen. If a breast screen shows indications of breast cancer, further tests known as assessment are undertaken. BreastScreen is not a program for women with breast symptoms. Women who do have symptoms should go to their doctor, who may provide a referral to a diagnostic mammogram, which is supported by Medicare and not part of the BreastScreen program. The BreastScreen team is made up of 3 main departments: screening services, reading and assessment services, and BreastScreen coordination unit. How we deliver our program. The BreastScreen Victoria program is a free service funded by the government. Appointments take 10 minutes, and it is with a female radiographer. You do not need a doctor's referral or Medicare card. There are 46 fixed clinics throughout Victoria. The BreastScreen Victoria program is delivered to eligible Victorians through 8 screening and assessment services located throughout the state. Collectively, these 8 services manage 46 permanent screening clinics and the mobile screening service, which visits 35 locations on a 2-yearly cycle. Do I need a breast screen? BreastScreen Victoria provides free mammograms to women and eligible trans and gender diverse people. Women aged 50 to 74 should be screened every 2 years, and we send invitation letters. We target this age group because mammograms are the most effective screening method for finding early breast cancer in this age group. Increasing age is one of the strongest risk factors. If you are in your 40s or over 75, you are still at risk and should talk to your doctor to find out if breast screening is right for you. This is why breast awareness is important for all women of all ages. Pre- and post-menopause breast tissue. The reason we target women in the 50 to 74 age group is that younger women's breasts are very dense and appear like white cotton wool on a mammogram. This makes it very difficult to see signs of breast cancer, which appear as a small white abnormality. Therefore, for women in their 40s compared to older women, it is less likely that breast cancers will be detected, and there is a chance that more women will be asked to come back for further tests when they don't actually have cancer. When a woman goes through menopause, her breast tissue is more likely to look like the image on the left, making it easier to detect breast cancer. The difference between high and low density breasts. High breast density means there is a greater amount of glandular and connective tissue compared to fat. Low density means there is a greater amount of fat compared to breast and connective tissue. A mammogram is still the best screening test to detect breast cancer early, even for clients with dense breasts. What happens at BreastScreen Assessment? Approximately 6% of women will be called back for further tests. These may include further mammograms, ultrasound, a physical examination by a surgeon, or a needle biopsy. If a cancer is detected, women will be referred to their doctor or a specialist breast clinic to discuss treatment options. It is important to remember that most women who are called back for further testing do not have breast cancer. COVID-19 vaccination and screening. If you have recently been vaccinated, it is very important that you keep your appointment and attend your regular breast screen. If we need any information from you regarding whether you have received the COVID-19 vaccine, we will let you know. Screening for people with a disability. Women with a disability are as much at risk of breast cancer as other women. Most eligible Victorians with a disability are able to have a breast screen. Other tests may be more appropriate for some. Talk to your doctor before booking an appointment. Culturally and linguistically diverse people. We want to make sure there are no barriers for clients getting a breast screen. To help the widest range of eligible Victorians, we provide culturally appropriate services that are accessible to people from diverse backgrounds. To support clients, we provide the following: translated resources, interpreter services, group bookings, and breast health information sessions. With Aboriginal communities, breast cancer is the most common cancer in Victorian Aboriginal women. But if caught early and treated, survival rates are much higher. The Beautiful Shawl project aims to improve breast screening experience for Aboriginal women using cultural screening shawls. BreastScreen Victoria worked with 8 Aboriginal community-controlled organisations across the state and local community artists. This project produced and provided customised screening shawls to Aboriginal and/or Torres Strait Islander women that are culturally appropriate, familiar, and beautiful to wear during their screening. From 2019, this wonderful project has visited 16 Aboriginal community-controlled organisations. With the LGBTIQ+ community and screening, we are committed to making sure our services are inclusive, welcoming, and safe for the LGBTIQ+ people. It is acknowledged and recognised that due to stigma and discrimination, this community are less likely to access the health services they need and when they need them. 22.6% of the LGBTIQ+ women aged 50 to 74 have never had a mammogram, compared to 10.4% of heterosexual women. Rainbow Sessions. BreastScreen Victoria holds dedicated LGBTIQ+ screening sessions called Rainbow Sessions to encourage members of the LGBTIQ+ community to screen in a safe and supportive group environment with ready access to tailored information and an opportunity to ask questions. The sessions are held at the Rose Clinic at David Jones in Melbourne CBD and have now been expanded into regional Victoria. BreastScreen Bendigo held 2 rainbow sessions in 2022 and in February 2023 were awarded third place in the Bendigo Health 2022 Quality Awards for a Rainbow Inclusive Clinic. BreastScreen Victoria's impact. There has been 45% decrease in breast cancer mortality in women aged 50 to 74 since 1991. 1.9 million women aged 50 to 74 participate in screening in Australia each year. Together, we have reduced the impact of breast cancer treatment through early detection. Australia now has one of the best breast cancer survival rates in the world, 91% after 5 years. BreastScreen Victoria diagnoses 37% of all breast cancers in Victoria. Our key messages: understand risk factors of developing breast cancer. Being breast aware, knowing the look and feel of your own breasts. Early detection is key to increase survival and quality of life. Breast screening has been a key factor in decreasing mortality of breast cancer. BreastScreen targets clients aged 50 to 74. BreastScreen is committed to inclusive, welcoming and safe services. And if you notice a symptom, please see your GP without delay. For more information or to make an appointment, book online www.breastscreen.org.au or call 13 20 50. We also offer group booking opportunities and can provide an Auslan interpreter on site if required. Thank you for your attention. We hope you have enjoyed the breast health presentation.